Hi, my name is Kendra Foster, and I would like to thank you for viewing my presentation on the Sunshine Manor Simulation Center at the Sunshine State University. I have had technical difficulties with uploading videos, so I'm going to try to make this video as short as possible. Thank you. The simulation center that I have is called Sunshine Manor. The Sunshine State University designed this simulation center, this interdisciplinary simulation center, and it's a academic-based simulation center. The mission for the simulation center is going to better help the practice of patient safety skills and improve education of the students in the nursing program, respiratory therapy program, and EMT or paramedic program. The vision of the Sunshine State University Simulation Center is to create simulation scenarios that are low and high level of fidelity for the nursing program, respiratory therapy program, and EMT paramedic program. The open space will in the end transform a simulation into one that trains all the different programs to work together in a scenario. I think this is important. I'll be going through a couple of the policies and procedures just so you can get to know the simulation center, the Sunshine Manor Simulation Center, more. In the Sunshine Manor Simulation Center, there will be tons of decisions that needs to be made. Mainly the lab coordinator or the director will be making these executive decisions, but the SOS as well as the lab assistant will definitely have some say-so as to what they think is more important, but the actual decision-making process will be done by the lab coordinator and the director. It is also important for me to mention our hours of operations. It'll be Monday through Friday, 7 a.m. to 3:30 p.m. We'll also offer Saturday classes, but for these classes, students have to sign up for these classes per course because there's 3 courses being taught, which is for the nursing, the EMT or paramedics, and the respiratory program. So based on how many students sign up for those Saturday classes, that decides on if we will have a class that Saturday. Next will be the administrative information, which I think is important for you to better understand the actual simulation center. This is the scope of work of each personnel's classification. Using the arrows, you can see that across from each one, such as the simulation specialist, it shows what they are responsible for in the Sunshine Manor Simulation Center. The simulation specialist is responsible for programming and running all the simulation equipment in the center, and goes on for with the unit manager, the staff development, the clinical educator, and the education assistant. And you can read to the right on what they will be responsible for. One thing I would like to make a note of with this organizational chart is the fact that everyone is important on this chart. If one person isn't on this chart, the simulation center will not be what it is. So all of these hands are needed to run a successful simulation center. And at the top is the executive directors, which are people of most importance, and they have the most votes, I guess you could say, with any decision making. And towards the bottom are the professors down here. As stated before, this course will be teaching, there will be courses in the simulation center, and they will actually be teaching the nurses, EMT, paramedics, and respiratory. And this basically shows you what each course content will include. Now, what makes this simulation center unique? Not just the name being Sunshine Manor, which I think is extravagant and is very opening and welcoming, and it actually goes with the school's name. There are other things that make this simulation center unique as well. One of the first things that makes this simulation center unique is that this is not just a simulation center. This is a hospital. That's one thing that we want to instill in the educators as well as the students, to call the simulation center a hospital. not a simulation center. We want the simulation center to be as realistic as possible and to instill into the students' heads that yes, this is a hospital, and we want to try to make this experience as real as possible for them, so it'll help them learn more. Another thing that makes my simulation center hospital unique, is the fact that it's set up a bit different. I don't know if you all can see, but there are little red marks here and here, all around the screen, well, all around the layout. These are actually doors, openings, one way in, one way out. Not really one way in, one way out. But basically the setup, I set this up in a way that everyone could easily walk all the way around the simulation center, and they weren't too far from anything that they needed, such as things that are in the storage room. They needed stuff in there, it's right there. They have two ways in to get into the storage room. So if they're on this side of the simulation center, they can easily come to this side of the storage room, and it's not necessarily, the walking distance would be minimized, as well as the fact that there is a debriefing room in the simulation center itself, and that the actual simulations are done in the center of this simulation center. I would say that's pretty unique because a lot of times it's done like in either room, and to have it just predominantly done in the center, it allows for there to be a more focused group, especially if you were to do a practicum or do interdisciplinary simulations. And yeah, so that would, I would say, makes my simulation center a bit different and a bit unique compared to others. One of the forms of simulations that we'll be doing in our simulation center are interdisciplinary learning simulations. This is actually because the Sunshine State University, who helped create this simulation center, the Sunshine Manor Hospital, their main focus was to have a lot of interdisciplinary learning simulations. So we'll be getting that done during practicums, which will be a form of using shift changes amongst nurses and shift changes with the paramedics as well in the respiratory program. The main simulation that would be interdisciplinary form of learning would be with the SimMom. With the SimMom, it'll have all hands on deck with the respiratory, EMT, or paramedics, and the nursing department. At the link, it's going to be a video basically showing how everyone will be involved in the interdisciplinary learning simulation for the SimMom simulation. Aside from helping with the interdisciplinary simulations, the SimMom will also be mainly used for nurses in the use of helping perform birth and any birthing related complications that can happen. That's where the nurses will come into hand. In the link, it will show the nurses actually working with the SimMom and the different details that the SimMom can help educate the students. Suppository will also be used in the interdisciplinary simulation, not the actual baby that comes out of the SimMom, but the suppository will also be used with the respiratory department, or the infant Annie will be used with the respiratory department program, and they'll learn how to see if a baby has cyanosis, give baby the PEEP score, and know the SpO2 of an infant, and how to give the APGAR score according to the baby's conditions. According to the baby's conditions, they will give an APGAR score. So that will be like a simulation scenario that will be done with the suppository for the respiratory department. Next is the SimMan 3G. The SimMan 3G is mainly for emergency patient. It's like an emergency patient simulator. That's why I mainly use it for EMT and or paramedics. I'm not saying that nurses will not be using the SimMan 3G, but this is just because Sim 3G is used to help with communication and handovers between departments. So I think that would also be cool to use for an interdisciplinary activity as well. But mainly EMT paramedics will be using this, and this is a Laerdal simulator, and it does also have functions that will help the paramedics know the heartbeat and any kind of pulses or anything that they need to know with the Sim 3G within this simulation. I would like to thank you for watching my presentation on my simulation center, the Sunshine Manor Hospital, that is at the Sunshine State University. Thank you.